Hey, it's PT from Total Country Bob FM. We're sitting here with Dr. Mark Lobanoff from North Suburban Eye Specialist. Sir, thank you so much for what you've done for me, first of all.
It's my pleasure.
Let's talk about, okay, so you're sitting at home and you have contacts you've been wearing for 30 years, okay, or glasses or whatever. And you're like, well, you know, LASIK is nerve-wracking for me. I don't know what I can do. We've been talking about the free consultation. Talk to us about what is happening during the consultation. What kind of tests are you running, and what are you educating the patients on?
You know, the first and foremost thing is we want to make sure that LASIK's going to be safe for that patient, that they're going to get a good outcome. And so we do a tremendous amount of testing on the eye. We're measuring curvature, shape, thickness. And then personally, I myself am examining that patient. I want to look at the eye, make sure things are healthy, because our goal is to make sure if we say, yes, you're a good candidate for LASIK, you're going to get that good result. You know, the other important thing is we find there's a lot of misinformation out there. You know, people think that the surgery is going to hurt, or because they have astigmatism, they're not a candidate. They think that we can't get people out of reading glasses, so there's a lot of misinformation kind of just swimming around the community. The second goal of that visit is just to educate the patient. Tell them, here's where LASIK is in 2014, here's what we can do, and to really just let them know what exactly LASIK is capable of.
It's almost like your own personal LASIK education section with that particular patient. I mean,
right. I mean, people these days, they go to the doctor and they say, you know, I was rushed through, I didn't get to ask my questions, things weren't answered. My goal is to buck that trend. I spend as much time as possible with that patient. I do it personally. I'm the one explaining things because I'm the surgeon. I'm the one that's going to be doing their procedure.
Yeah, and I think that's super important. It's almost like building that almost rapport with that patient so they understand. And I've talked about that a little bit, is that, you know, Dr. Lobanoff is not just some, you know, person who flies in, you know, over the weekend, we're going to hammer out, you know, 14 LASIK surgeries and then we're out of here. I mean, you're right here locally, Blaine and Coon Rapids. You're actually meeting with the patients on a one-on-one basis, not only the pre-op, but beforehand with the consultation, everything.
Right. So many other places, you don't meet your surgeon. Someone with less training, less background is the one that's meeting you, examining you, trying to explain the surgery to you. I don't think that's the right way to do it. The way that we do it at our center is the surgeon is the one that's going to meet you, examine you, and explain things to you in language that you can understand. So that's the goal. That's what my primary focus was in building North Suburban Eye Specialists up. So we are the North Suburban Center. We live in this community. We treat our neighbors and friends here. We're not just some corporate structure from across the country. So we really try to tailor towards Minnesotans. We're a resource for them.
That's cool. That's really awesome. Again, it's Dr. Mark Lobanoff, the best at North Suburban Eye Specialist.